Hey guys, it's Emily. I'm going to tell you about this super gnarly disease called syphilis. Alright, so what is syphilis? It's a sexually transmitted disease caused by a bacterial infection, namely the bacteria Treponema pallidum pallidum. And no, I didn't repeat pallidum twice on accident. It's actually the name of bacteria, more commonly known as TP pallidum. The disease syphilis manifests itself in 4 distinct stages, and we'll talk about those a little bit later when we discuss signs and symptoms. But first, we can talk about the structure of this bacteria and what makes it so special. So as you can see from the picture, it's a spirochete bacteria, which means it has a spiral sort of shape. Essentially, this allows it to move in a corkscrew motion to penetrate your layers of skin and cause infection, and that's what contributes to the great virulence of this disease. The bacteria is able to just corkscrew right into your skin. All right, so how do you get it? Syphilis can be transmitted in 2 ways, either venereal or congenital. So venereal, it's spread through sexual contact, whether that's oral, vaginal, or anal, and congenital is from a mother to child before or during birth. The transmission occurs when a person comes in contact with an open syphilis sore on an infected individual. And whenever I talk about the primary stage of syphilis, which this sore is a characteristic of, I'll tell you more about how that happens whenever you come into contact with the sore and how you get syphilis from that. So signs and symptoms, the primary stage. This is the first thing that shows up whenever you get infected with syphilis. It happens 3 to 90 days after infection, and all it is a painless skin lesion called a canker that appears at the site of infection. So whether it's the penis, the vagina, and the cervix, the anus, or somewhere in the mouth and the throat. And as you can see from the pictures, these sores are open wounds, but they don't hurt. But what happens is if you come in contact with one of these sores, that's where the bacteria will move onto an uninfected person's skin, and those spirochetes will drill in there, and they'll cause syphilis that way. So the way that you get syphilis is by coming in contact with one of these sores. And the catch about syphilis that makes it so tricky is that oftentimes these sores will be somewhere in the mouth, or the vagina or the throat where you won't see them, so you don't know they're there. And because you can't feel them, oftentimes people don't even know that they have syphilis in the primary stage unless they can actually physically see the sore. And that's what contributes to its great spread. All right, so the secondary stage happens 4 to 10 weeks after the primary infection, and the signs and symptoms of the secondary stage are a non-itchy rash on the whole body, and it can become pustular, as you can see on the picture of the feet, but for the most part, it's just these little dark brown reddish dots that show up all over your body, characteristically on the hands and the bottom of the feet, which is very unique to syphilis. You have swollen glands, a fever, weight and hair loss, and head and muscle aches and fatigue as well. Next, we move into the latent stage. Early latent stage is characterized as less than a year after the secondary stage, and late latent stage is characterized as more than a year after the secondary stage. And the unique part about this stage is that all of the previous symptoms will disappear, and the signs and symptoms of the latent stage are absolutely nothing. So the only way that you know that you have syphilis is if you get a blood test done, and you can find the bacteria in your blood. After this, you can move on to what is the tertiary stage, or the 4th and final stage of syphilis, which is really bad. Only a third of untreated individuals will get this 10 to 30 years after the primary infection, but there are different types of ways that the tertiary stage can manifest itself. First is neurosyphilis, which attacks the central nervous system, and that will cause deterioration of the nerves, that will cause paralysis, it'll cause deterioration of the brain and lead to dementia. And neurosyphilis is the least likely of the 3 that you see here, but it still happens. And then there's gummatous syphilis, and gummatous, the name comes from the term gumma, which is these growths that appear underneath the skin. They're non-cancerous, they're benign, but they misshape the face in different parts of the body when they grow. And as you can see from the picture of the man here, gummatous also causes necrosis of the face and the skin. So this is what you end up looking like whenever you have gummatous syphilis. It's really, really bad. And then the most common one of these 3 that you see here is cardiovascular syphilis, which usually ends in an aneurysm, and that causes death through that way. So how is syphilis diagnosed? It can be difficult to diagnose, especially in the early stages, and if you can't see the cankers, like I said, you can't feel them. So normally it's pretty hard to diagnose until that rash shows up all over your body in the secondary stage. The only way to confirm absolutely that you have it is if you get a blood test done. How dangerous is it? So syphilis, the great thing about it is 100% curable with antibiotics. In 2015, it infected 45.4 million people worldwide, which is approximately 0.6% of the world population, it's a lot. And it caused around 107,000 deaths. In the U.S., the number of infected individuals continues to increase each year, and I'm not exactly sure why that is, but if I had to give it a guess, it would probably be because more numbers are being reported than they were before, or more people are being tested and found positive for it. And the reason that syphilis continues to thrive in such great numbers throughout the years, even to the modern day, is because most of the places where this disease ravages is in third world countries where they don't have access to antibiotics that can help cure and stop the disease. So when left untreated, syphilis has a mortality rate of 8% to 58%, which, like I said, happens in those third world countries. And it really doesn't occur at all in developed countries and that have good healthcare systems that can provide patients with the treatments they need. If no treatment is administered after the latent stage, like I said before, 1/3 of the infected individuals will develop tertiary syphilis, one of those 3 forms. But most people remain in the latent stage, and they will actually be asymptomatic unto death. So this here is a chart laying out the number of syphilis deaths per million persons in 2012. And as you can see, in developed countries like Russia and in Europe and in America, there were 0 deaths. Because the people who are here have access to healthcare that can provide them antibiotics to get cured from the disease. And in the places where the deaths are most prominent are in countries in Africa where there aren't developed healthcare systems and where citizens aren't educated about the danger of sexually transmitted diseases and how to prevent them. So the disease just keeps going. So how do you prevent syphilis? There's no vaccine available for it, probably because it's so easily curable by antibiotics. Other diseases are going to have higher priority. But there are several ways of preventing or minimizing the risk of infection. So the first is practicing abstinence. But if you're sexually active, you can get tested for STDs regularly, just to get checkups to make sure you don't have it. You can use a condom when engaging in sexual intercourse, but that's only going to protect you as long as the condom is covering the area where there's that canker sore that has all of the bacteria on it that can cause infection. So if it's covered, then you'll probably be okay, but if it's not, the disease is still going to spread. And the third option is having a monogamous sexual relationship with a partner who's tested negative for the disease. So if you're both negative, you both can't get it, right? So a brief history of syphilis is it first came about in 1494, 1495, somewhere around there was the first written account of syphilis outbreak recorded in Naples, Italy. And actually, syphilis didn't appear in Europe until after Christopher Columbus made his voyage across the pond to America, and then he came back to Spain. So one historical hypothesis is that syphilis is actually from the Americas, and Christopher Columbus just brought it back to be manifested and recorded in European history after he returned from his voyage. Then in 1530, the term syphilis was coined by physician and poet Girolamo Fracastoro as the name of a character in one of his poems describing the effects of the disease in Italy. So the name syphilis is actually the name of a character that was written about in a poem by a doctor who was describing the disease in Italy. Then in 1905, the bacteria TP pallidum was identified as the causative agent of syphilis. And in 1910, the first treatment for it, called Savarsan, was discovered by Paul Ehrlich, and it wasn't used as effective treatment until it was used with penicillin in 1943. So one of the big landmarks of syphilis were the heinous Tuskegee and Guatemala experiments that I'm sure you guys remember. So the Tuskegee experiment went from 1932 to 1972. It was supported by the CDC and conducted by U.S. Public Health Service and Tuskegee Institute in Tuskegee, Alabama. The purpose was to observe and record the natural progression of the disease, but as we know, it was terminated as a result of public outcry and gave rise to an ethical code of conduct that should be followed when performing medical studies on human beings. Equally as infamous as the Guatemala experiment, which lasted from 1946 to 1948. That was sponsored by the U.S. government and conducted in Guatemala under supervision of the Guatemalan government. The purpose was to test the effectiveness of penicillin in treating syphilis, but prisoners, soldiers, and mental health patients were infected without informed consent with syphilis and then given antibiotics to see how effective they were in testing them. And even so, around 40 people died from these tests. So it was terminated due to unethical practices as well. So ongoing research on syphilis. As of now, there's no active study underway for developing a syphilis vaccine. And like I said, it's probably not necessary because syphilis is so easily cured by antibiotics, which leads to my second point, that there have been few cases of antibiotic-resistant syphilis that have warranted second-line antibiotics and nothing verging on third line. So as of right now, the bacteria isn't dangerous enough to warrant needing a vaccine because it hasn't adapted to move past and become resistant to second-line antibiotics yet. Those are still pretty effective. And all syphilis so far has been terminated by some form of antibiotics when it's been treated with them. And then the spread of the disease would decrease in the world with the education of citizens in third world countries on STDs and safe ways to prevent them, and development of healthcare systems in those countries that can provide its citizens with antibiotics that can help cure the disease and eliminate it from humanity, like it has been in more civilized countries like America and the countries of Europe. All right, guys, those are my sources. Thanks for watching. See you in class.